Okay, so a little bit on medical uses of cannabis. As we mentioned, its earliest mention in human writings had to do with its medical uses, and it was in common circulation as a pharmaceutical before the Marijuana Tax Act. Now, after the Tax Act, it did decline. Definitely because of the cost and the difficulty of obtaining it. But we also saw a lot of pharmaceutical development over that past about 80-year period. And we started to see drugs that were targeted for conditions like anxiety and pain and that sort of thing. So more targeted drugs that were more easily available for many of the illnesses that marijuana or cannabis was used to treat before that time. And also, in the way that the product was delivered, we didn't see the kind of consistency in marijuana that we saw in some of those prescription and over-the-counter drugs. We also saw a strong trend during this time period towards the use of injectable drugs, and the active ingredient in cannabis, THC, is not water-soluble, so it can't be used as an intravenous injection. So that idea of an oral dose would delay the onset of action, and when we're talking about pain or anxiety, we're looking for something with a shorter time course. So that was before the Tax Act. I'm sorry, shortly after before and after the passage of the Tax Act, so the early 20th century. Now in the later 20th century, so the 1970s to the present time, we've seen renewed interest in medical uses for cannabis, both for chronic conditions like glaucoma, and then also for the nausea related to conditions such as cancer treatment. We've also seen some really exciting work done with marijuana and seizure disorders. And one of the things that's really interesting about this particular line is that it's not so much the THC that is the active component here as cannabidiol. So another one of those cannabinoids that seems to be, in some cases so far, has been very, very helpful for people with severe seizure disorders. So interesting that we have some treatment available that doesn't actually have to do with marijuana that's high in THC. So we've also had marijuana that has been processed for medical use that actually has been in circulation since the 1980s, 1990s. The brand name here is Marinol, and this is an oral THC preparation, and is actually used as an antiemetic. So it was approved for sale to people who are experiencing nausea from chemotherapy in 1985. We also saw some off-label use for people who are experiencing some autoimmune conditions like arthritis and multiple sclerosis. And it was also found to stimulate appetite, and in 1993 it was approved by the FDA for sale to AIDS patients to help address the wasting and the extreme weight loss that was associated with that condition. In terms of the federal and state regulatory stance on medical use, we did see in 1999 a report from the IOM, so a leading medical organization in the United States, that recommended the use of marijuana under certain conditions. And these would include failure of any currently approved medications to treat the condition, the fact that there were symptoms that would be relieved by a rapid onset. Remember, this is inhaled marijuana, so its time course is going to be more rapid, and that the treatment continued to be under medical supervision, so the patient wasn't just prescribed marijuana and then cut loose, but they continued under the supervision of a medical professional, and that there was an oversight strategy for the dispensing of marijuana. We saw the first legal medical use due to laws passed at the state level in the United States in 2013. Of course, it's important to note again that marijuana is still considered a Schedule I drug at the federal level. So we have this real conflict right now between states that not only have legal medical use but also legal recreational use, while the federal government still considers this a Schedule I drug. Okay, so let's talk a little bit about abuse and dependence within the marijuana setting. So we've got a couple of different issues to discuss: tolerance and withdrawal, and then toxicity. So we do know that regular marijuana users do develop tolerance after high levels of regular use. Low levels on a recurring basis don't seem to have the same effect, but we do see tolerance at that higher level. And it may not develop to all of the effects at the same time, and it may never develop for some and develop for others. So still a lot to learn about how that would actually work. In terms of withdrawal, we do not see a diagnosable withdrawal syndrome in the DSM, but the research does suggest a group of symptoms that would occur, a syndrome, when people stop consuming marijuana. It's not considered life-threatening. It is apparently unpleasant and would typically begin about a day after the last dose. The severity here, of course, is going to be related to the amount of marijuana that was consumed during that period, but it is reported to last 4 to 12 days, or for much more regular chronic users, several weeks to a month, and can include disrupted sleep, the irritability we'd associate with that, also anxiety, and then perhaps decreased food intake because of the appetite regulation that's associated with marijuana use. We do see a low rate of dependence, about 4%, but with widespread use, we may see more. We may see more of this occur, and of course more withdrawal symptoms that are associated with chronic use, and also higher potency. The higher potency preparations are associated with more withdrawal as well. Now keep in mind, this is still less common and less severe than alcohol. We do expect that about 15% of alcohol users will become dependent on alcohol, and of course keep in mind that alcohol withdrawal can actually be fatal. So some interesting things to consider about the legal and illegal status of drugs in the United States. Okay, so the toxicity potential of marijuana. We've got both acute and chronic symptoms to discuss. The acute physiological effects, we do see increased heart rate. We saw our charts with the dose-dependent and method of consumption-dependent patterns there. So for people who have pre-existing cardiovascular disease, there may be additional risk here. Again, not a lot of data on this, but that factoid you may have heard reported that no overdose deaths have ever been associated with marijuana. That is true as far as I know. Plenty of deaths in terms of behavioral toxicity, the poor decisions that we might make while under the influence of the drug, but it is not at this time something that we know you can do, to smoke yourself to death. Now, the smoking component of marijuana is something to keep in mind. The chronic exposure of the respiratory system to marijuana smoke it does not at this time we don't have clear evidence that it's associated with respiratory symptoms or lung disease. But we do know that marijuana smoke contains many of the same carcinogens that we find in tobacco smoke. Because of the lack of data in this field, it may be something we find out more about over the next couple of years or couple of decades. We just really don't know yet whether marijuana smokers are increased risk for cancer. We do know that the amount of smoke that marijuana users inhale in about 4 to 5 joints is about the equivalent of the amount of smoke in a pack of cigarettes. Now, when marijuana smokers also smoke tobacco, there we definitely see increased risk, a multiplicative effect when we combine the effects of marijuana and tobacco on the respiratory system. So definitely a higher risk category for somebody who smokes both products. In terms of reproductive effects, we do see habitual marijuana users who are male reporting lower testosterone levels and both diminished sperm counts and abnormal sperm in men. Interesting results from the research among women who are pregnant. Marijuana use by pregnant women does not actually appear to be associated with negative birth outcomes, but this is a limitation of the data as well. We have so few pregnant women who report using marijuana, either due to behavior change or due to social bias. We really don't have good data in this difficult to research topic. In considering what we know about exposure to high levels of marijuana during the brain development associated with teenagers, it'd be difficult to think that would not have some kind of effect on the developing brain before birth as well. At any rate, it's definitely a difficult topic to research, and we should be again hearing more about this as research into marijuana use becomes more widespread. In terms of immune system effects, again, not a lot of really great data here. We've got mixed findings. Some say that marijuana use reduces immunity. and then some studies saying that there's no relationship with immunity at all. So no real clear data on this one as well. In terms of mortality rate, if we look at just sheer all-cause mortality, we do not see a relationship between marijuana use and overall death rates. So still a lot to learn and some interesting areas for research here. Now, in terms of other kinds of toxicity, we do see some increased anxiety levels that are associated with some more frequent users of marijuana. And there are some people who seek actually medical treatment and a pharmaceutical approach for that. But talk therapy does seem to be most effective in this case. And then also, of course, reducing consumption. Now, we also have this, if I mention the cultural stereotype of a stoner, and then you'll know exactly what I mean about amotivational syndrome. So we've got this this societal stereotype of somebody who's a consistent marijuana user who doesn't have that kind of higher level of motivation that we expect to associate with greater degrees of success. We don't at this time have clear data that frequent marijuana smoking is associated with diminished motivation, but we do have those new questions about exposure to the developing brain and the possibility that there's a stronger link with early initiation. So again, as we keep saying with our marijuana research, lots to learn here. We talked a little bit about driving ability when we talked about developing tolerance. We do know that infrequent users or novice users can experience significant impairment in their ability to drive at levels of consumption that really don't seem to have a lot of effect on people who are more experienced users. So that should be an interesting area for legal development over the next couple of years. So in terms of that kind of long-term effect on mental health that was addressed in our movie trailer, that idea of reefer madness. There are some studies that have found a correlation between marijuana use and psychosis, and then there are others that show actually fewer psychotic episodes in people who use marijuana on a regular basis. So what's really the interesting question here is which is causing what? Is it possible that a person is experiencing psychotic symptoms before using marijuana and perhaps using marijuana to self-medicate? And there's also the clustering of drug use here. Is it possible that other drugs besides marijuana could be starting to induce those psychotic symptoms? We do know that among people who become dependent, that we do see some differences in dopamine structures and neurotransmitter levels. So some really interesting questions more than we actually have answers. We do have evidence that among people with a history of psychiatric problems, that marijuana may increase the likelihood of them having psychotic episodes. And this may, again, be attributed to differences in neurotransmitter levels and structures. So lots more questions than answers here in terms of the pharmacological effects of marijuana. So wrapping up our third marijuana lecture here today, we started by talking about the cannabis plant and the different preparations, the regulatory history and the current cultural climate around marijuana use here in the United States in the 21st century, the pharmacology of marijuana, and THC, medical uses for THC as well as some of the other cannabinoids, and then also its toxicity potential. And that will wrap up our lectures on marijuana. Thanks for sticking with me. I hope you found it interesting.